morning, and after a holiday hiatus, we are to visit with folks from Imperial County about the COVID-19 situation in the Valley. And today with us is Dr. Kathy Staats and from the Imperial County Public Health Department Emergency Services area. And before we begin, well, first off, good morning. How we doing?
We're doing good, Carroll.
Doing well. Thank you for having us.
Well, I do want to pass along some, personal observations. The local emergency services personnel have been responding in a magnificent manner to, situations that, 10 months ago weren't even in our dreams, were they?
That's correct, Carroll, and I think we've gone beyond anything that anybody expected our system was capable of, and our personnel out in the field have been handling it tremendously.
And of course,
I think we're incredibly proud of what our providers have done and how everyone has really come together and adapted to this really challenging situation.
Well, and in many cases, putting their own safety at risk as they handle this crisis. So we salute them, and we're talking about, not just the fire personnel, police personnel, the ambulance people, the emergency rooms, all of the people involved in the emergency services area have been doing a bang-up job. Now, are they getting the vaccine now?
Carroll, they are. We're working through a lot of the, vaccinating a lot of the providers. Actually, I'm out at our alternate care site today, getting some of those personnel as well as some of our local EMS personnel through some more vaccine clinics out here with our public health nurses. Since we started the vaccine rollout the third week, a couple days before Christmas, we've done just over 250 of our EMS personnel in the county.
Okay, and I mentioned earlier this morning. Okay, the number of doses of the vaccine available in Imperial County is very, very small. Personally, I point my fingers at Sacramento and Washington. The information I got this morning is only about 25% of the vaccine that has arrived in California has been distributed so far. So, they're working on the fly, but you would think at some point they would get it together and it would filter down to Imperial County. You would think.
Yeah, and Carroll, I think the challenge for everyone from us here at the local level up to, the state and federal level is the vaccines that are currently available there's the logistics involved in storage, handling, and transportation of these vaccines is tremendous. Our own public health staff has done a really fantastic job of sorting through all the different requirements and making sure all the storage, minus 80 freezers and transportation coolers and everything that goes into moving these vaccines around is in place. I think as additional doses from the manufacturers become available, as everybody kind of gets into the groove of the distribution and administration of these vaccines, I think we'll see the process get streamlined fairly well and the pace quicken here in the next really week to 2 weeks. I think we're going to see that pace speed up quite a bit.
Okay, one of the questions that we get asked repeatedly, we get a number of phone calls every day, and I'm sure the health department does as well. When is the general public going to be able, I know when the vaccine is available, but is there a timeline or an estimate on when that might be?
I think that timeline is a bit of a moving target at this point. And the best timeline that we've seen so far is going to be coming up in the spring, and that's still a very broad range of time. We understand that can be, a little nerve-wracking and make the public nervous, but just want to assure everybody that as we move through these different phases and tiers of vaccine distribution, that timeline gets more and more specific. If we go back to October, September timeframe, they were talking, vaccine will be hitting the streets in November. And then as we approach those timelines, the dates really do start getting more set in stone, so to speak. So as we approach, going into February and March, I think that timeline is going to be really narrowed down to something a lot more practical for everybody.
And of course, the state has issued their tier system as to, at what point people will be vaccinated. Right now, where are we in that tier system?
So there's kind of two pieces. We have different phases, and within each phase you have different tiers. So we're currently in phase 1A. We've been vaccinating tier 1 for the last 3 weeks, and we actually started vaccinating some providers in tier 2 earlier this week. Okay,
and I know that CVS and Walgreens are involved in the vaccination program, I believe, at nursing homes and assisted living facilities?
That's correct.
Okay. Is the general public going to be able to walk into a CVS or a Walgreens and say, hey, I want the vaccine?
So not in the near future. I think we'll start seeing some of those kind of programs become available more to the general public later on in the spring. The way this first partnership with the pharmacies is set up, the CVS or Walgreens are working directly with the state and federal government, and they're actually going out and doing on-site vaccination clinics at skilled nursing facilities and different assisted living facilities all throughout the country.
Okay, are private physicians able to administer the vaccine? Is it available to them?
So private physicians' offices should be getting included as part of this Tier 2 rollout. And just like everything else, as we move through the tiers, we're going to be adding vaccine providers to our community's list of vaccine providers. Kind of like what we're doing with our Phase 1A Tier 1 groups. It starts with very specific populations. So the goal is to, vaccinate these healthcare providers that are working in the highest risk settings, and then moving through that risk, the different risk, tiers, essentially, vaccinating the personnel. That way, as more doses become available, they're able to turn around, become vaccinators, and assist with vaccinating the public and their patients.
Okay, one of the things the governor announced earlier this week was, we'll let dentists administer the vaccine. Is there any sort of a training plan or any plan in Imperial County that would lead to that?
So we can't speak to the dentist, although we do have Dr. Staats, and maybe Dr. Staats, you want to talk about some of the things we're working on with our EMS personnel to kind of add to that roster of providers who are able to vaccinate the people.
Yes, absolutely. So as Chris mentioned, our first responders, our paramedics, our fire personnel are currently getting vaccinated. And as we look ahead and identify that it is a large logistical undertaking to vaccinate our community, we will be training our first responders, especially our paramedics and EMTs, to administer these vaccines as well. So we'll be incorporating them into our plan as we roll out vaccination on a community level.
Okay, I just conjured up a picture. I have 4 sisters. 3 of them are RNs. And I remember when they were in school to become an RN, they used to practice injections with vodka into an orange. I just have pictures of the EMS personnel.
That sounds like it could be fun. We are doing it a little differently nowadays, but it's really fantastic. From the state level, there have been guidelines that have been sent down from the EMS authority, and then each sort of local area is adapting them. So we are doing something very similar in Imperial, developing those training materials, and then shortly we'll be doing those practical stations, more likely with real arms than oranges and vodka, but that method sounds fun.
Okay. Now, the county has had experience with the drive-through flu clinics. Is that on the board?
You know, Carroll, that's a great observation, and I think, you know, so coming from the emergency management side of the hat that I wear within the EMS agency, so our health department for the past 15, 20 years has done a variety of different types of mass vaccination clinics using our flu vaccine, and the reason that we've done those, whether it's the drive-through flu clinics or we've even done smaller, we were calling them pop-up type clinics where a handful of public health staff would, you'll start at a library in Calapat and then move to Westmoreland at a church. So all of those different activities and all of those different exercises were essentially, helping us figure out where in our community we can provide vaccines in traditionally non-clinical settings like a drive-through at the fairgrounds, or a pop-up clinic in a church parking lot, etc. So all of those options are definitely more. I would say more than on the table. They're being fleshed out, and the plans and processes are being finalized. Kind of as we speak, to be able to go into these locations and provide vaccines to our community in a large scale setting, because we understand that we have 190,000 plus people in Imperial County, and it's going to be impossible to get everybody through just the pharmacy or their doctor's offices.
Okay, let's talk about some of the services as they are available. Okay, El Centro Regional with licensed capacity of 161 beds, at one point had like 180 plus patients. Now, there's a temporary med-surg unit set up in the north parking lot. There's a triage tent set up in the south parking lot. And now there is an infusion therapy temporary setup as well. Are these continuing?
Yes, Carol, and I don't know, Kathy, if you want
to. So currently, those resources are continuing. After Thanksgiving, of course, we saw a very significant surge in the county. Following the most recent holidays of Christmas and New Year's Eve, we've seen maybe a small increase, but nothing compared to what we saw on Thanksgiving. We're not yet potentially avoiding that significant second surge, but to be as prepared as possible, we are maintaining these resources until we see how our community has responded following the most recent holidays.
Okay, and the alternate care site set up at Ivy is continuing to function?
Yes, currently continuing to function as well. We have around 25 patients in there this morning, and we can take a few dozen more as well.
Okay, so the response from the state and from the federal government has been quick and very, very beneficial to the Valley.
Yeah, and I again, my background, and I know when Mr. Rahotis, our county CEO, with his background as the fire chief and director, this truly is an unprecedented response for our county and really our country at this point. In very eye-opening and very wonderful to see all these systems that have been put in place over the past, 20, 30, 40 years, particularly in California, our strong mutual aid system. It's been very, heartwarming to see all of these systems actually functioning, really well beyond what anybody ever expected they would be able to do, for, the duration of this event. We're going into, I think we're on month 10, for California, really, of this response. Actually, it's almost been a year. I know the state activated their Emergency Operations Center and Department Operations Center for Public Health and their EMS authority in January. We're a couple weeks shy of a year. These systems are functioning well, and the response, really has been very focused in, the most impacted areas, kind of as the surge went from place to place across the country. I think we're in the midst of kind of hopefully the final surge, right, with vaccine rollout. But it is more widespread, and it's been wonderful to see the systems be able to handle what they've been handling for the last year.
Well, in the press conference yesterday, Dr. Monday said, at this point, we have not seen that variant of the COVID-19 strain that is popping up. Doesn't mean it's here. It just means it hasn't been identified here. But that, from what I am seeing, is will be covered by the vaccines. It will work with them. And as the doctor pointed out, hey, yeah, all of these viruses, they do change. Mm-hmm. They morph into something different.
Absolutely. But it has been reassuring with the data so far that even with this newer strain, the vaccine will still be able to target it and protect the patients that receive the vaccine against this newer strain.
Okay. Have we missed anything that you wanted to cover?
I don't think we've missed anything. I do kind of want to circle back. I think you started the conversation this morning off really well with talking about the hard work and dedication that our healthcare and EMS systems have been moving through this response with. And I think personally for me, it is a tremendous ask for them to continue, but they don't hesitate. They put their boots on, they put their scrubs on, they continue to go to work, run the 911 calls, continue to treat patients in the ERs and all of these other non-traditional areas, whether it's a tent or a IVC gymnasium. So thank you to all of the providers, from the 911 dispatcher who answers the 911 call, to the physicians that are providing some definitive care in the hospitals, and every step of the way in between.
And I would absolutely echo that 100%. And our local providers, as well as those that have collaborated us with our county's response, regional, state, and federal partners, all coming together in really unique ways. And honestly, every day there's a new challenge that our providers are meeting. So it's been humbling and gratifying, and just really encouraging just how well our providers have responded to this crisis. So from the bottom of my heart and the EMS agency, we thank them for everything they've done.
Okay. Chris Herring, Dr. Kathy Staats, we appreciate the visit this morning. And just to remind you that this is available on the KXO YouTube channel and the KXO Facebook page as well. So you can go back and listen to it over and over again. Okay. You both have a great day. Stay safe. Stay healthy.
You as well, Carroll. Thank you.